Patients in the state hospital arrive with many and complex conditions. Some suffer from both mental and physical health conditions, and this calls for exceptional levels of dedicated and tailored support from highly dedicated staff. It is in this area of care, known as the Intellectual Disability Service, that we now focus on, to showcase the remarkable work of a team led by consultant psychiatrist Dr Jana de Villiers.
So the Intellectual Disability Service is funded for 12 beds, and it provides high secure forensic mental health care for people from Scotland and Northern Ireland who have intellectual disability.
For the past 3 years, around a dozen patients with extremely complex physical and mental health conditions have benefited from a highly effective approach developed and delivered by a multidisciplinary team. These are patients with conditions such as ADHD, bipolar disorder, epilepsy, autism, schizophrenia, sight or speech impediments.
People with intellectual disability, it's quite a complex patient group. So there's commonly other additional neurodevelopmental disorders such as ADHD or autism. A significant proportion will have comorbid mental illness such as schizophrenia or bipolar disorder. And then people also have higher rates of physical health problems, including conditions such as epilepsy or cardiovascular issues or sleep apnea. There's a whole range, but people tend to have a mix of both mental and physical health conditions.
They arrive at the state hospital because there's nowhere else that can offer them help, nowhere else they could cope.
Many people with intellectual disability, due to their cognitive impairments and long-term disability, cannot effectively participate in court proceedings, and for that reason need to be managed through the mental health route. In addition, many people will struggle in a custody setting, for example, will display extreme distress or develop mental illnesses in that setting and need to be in a setting that can meet all of the complexity of their needs.
Despite the huge challenges these patients present, Dr de Villiers and the team have witnessed quite remarkable success.
I've been in my current role since 2018, and since being at the State Hospital, I've been delighted to be part of a team that's very enthusiastic, very motivated. Everyone wants to provide the highest possible care they can and to help the people within our care to achieve as much as they possibly can. We have a very strong focus on continually improving the service that we provide, seeking feedback from both patients and carers and other stakeholders to make sure that we are continually doing that. We want to provide a safe and nurturing environment, both for the patients, but also for all the staff within the service. And we think by doing that, we then give the patients the best chance to succeed once they are ready to move on from the State Hospital.
Against all the odds, they've developed new skills and new confidence. Frustrations and levels of anxiety and sometimes violence have been dramatically reduced. The patients have learned to work with staff and move forward together to open a route to progression out of the high-security hospital setting, a step towards a more fulfilling and rewarding life.
So the treatment we provide is very holistic. We want to be able to provide the patients with skills that they may have never had the chance to develop in the past, but now can develop. The aim is for everyone who's with us to move on. Some people will be here for quite short periods of time and others need much more lengthier stays with us. But the ethos is always that our aim is to help people move on successfully. We're not wanting to be in a position where this is the end destination for anyone.